The World Health Organization says a mysterious new virus detected in the Chinese city of Wuhan.
The respiratory virus outbreak coming from China.
It's a strain they haven't seen before.
This morning, Europe on edge, as Italy sees the number of people infected with the novel coronavirus soar.
The city of Daegu is at the center of an outbreak.
Cruise ship that's been quarantined in Yokohama.
A record daily surge in new coronavirus cases.
COVID-19 can be characterized as a pandemic.
When the announcement of the pandemic happened, it overwhelmed me with the fear that we need to do something now.
And I was very shocked in how fast it spread.
I was actually scared because I knew what had happened with Indigenous people and smallpox, and I knew what happened in 1918, just with my own grandpa, stories of burying people. Right, and having the church bell going all day long, and what if this was the worst case scenario?
In some ways, being in the North was sometimes a benefit, and then sometimes increased the challenges. We're a very remote community, and we don't have a lot of access to services. A lot of people probably don't know that for many, many years and decades, we've had to travel out of town to be able to have babies.
With the northern region, we are more than half of the province, the top half, where we go from Prince George over to Haida Gwaii, up to Atlin, over to Fort Nelson. So traveling between any one of those communities from one end to the other could be at least 18 hours of travel. Some of our communities that fly in are ferry or boat, and some are by forest service road, so there's many challenges. And then when you throw in the weather, and our weather is so unpredictable in the winter months that the roads are quite hazardous.
So an outbreak of a pandemic here would be overwhelm our system like overnight if people were getting sick.
The first thing we did is we shut the community down. And in that time, our community put together an emergency safety plan for COVID.
This was so new to everybody. We had to work a lot behind the scenes so that we would be able to continue to carry on. Probably one of the most difficult pieces was sharing the messaging on you need to limit your household interactions.
We're a people that like to gather, plus we also have big families.
In Niska culture, we call First Nations people like alugigat, which means like, you know, people who live in the open, right? And so it means that nothing's done secretly, nothing's done like privately. And COVID has kind of forced us into this nature of being really isolated and private.
Throughout this whole thing, our elders were basically held hostage in their homes. To see the heartbreak, not being able to see their grandchildren.
But I said, as long as we're laughing and connecting and making moccasins and beading and going out hunting and gathering, and just that connection is still there, and it hasn't won.
And then there was like different initiatives, like they had like youth submitting videos for COVID. My daughter did a little rap video on like COVID-19, and like there was this like challenge for who could have the nicest lawn makeover. And it was just, you know, and like people were really proud posting on Facebook, and they won this prize and that prize.
And then the toilet paper thing was, that was hilarious to me. Like that's, even my grandson goes, "What's with the toilet paper?" And I'm going, I have no idea. Like, I don't know. So now that's the running joke. Everyone's like, make sure you got toilet paper. We can use it for bargaining if they shut down again.
All right there, make sure your number's visible, boys. Make sure your number's visible. Kind of shake your ropes like that a couple times. What do you say?
Important to wear a mask. We knew that First Nations people would likely be more vulnerable. How do we make sure that First Nations people, especially in remote locations and rural locations that don't have access to healthcare, how would we make sure they are dealt with first?
We knew we couldn't address this without having strong partnerships throughout the health system and sharing promising practices, and so it was about realizing that.
So in the beginning, we didn't really know how to Zoom, and we're like, what's Zoom and how are we going to do this and whatnot? But we've kind of, like a year and a half later, become old hands at using Zoom. And one of the cool benefits of that is that we're able to connect with communities from across the entire North at the same time, like on a weekly basis.
Many of our communities were shutting health centers down to protect community from the spread of COVID, but that really created barriers for community members to access physicians, to seek other kinds of health and wellness supports. And so we created the Doctor of the Day program and the Addiction Medicine and Psychiatry program.
Hi, yes, I'd like
We
to
have a standard number that a community member can call.
Thank you for calling into the First Nations Doctor of the Day program. My name is Dr. Aldred.
They're greeted by one of our medical office assistants. The patient is then seen that day.
I'm just calling in because I woke up with a sore throat, and
some communities have little to no access to closer to home or in community care. There's also systemic challenges around racism, the ability to travel to different locations. And so creating our First Nations Virtual Doctor of the Day gave us an opportunity not only to reduce those barriers and improve timely access to care, but also to provide an opportunity for immediate, real-time, face-to-face support for that nurse or that health professional.
Well, what the pandemic really showed was many people are in need of supports around addictions, and nobody's there with them. And if it's a toxic drug supply and they do overdose and die, there's nobody there with them. And our communities have lost too many people to opioids.
Needing for naloxone, and the opioid crisis even got worse in that with COVID, a lot of the supply got shut down. There were no treatment centers, they were all shut down. Detox, it was just, everything was so hard.
You can't go to the hospital, you can't go to anywhere to sleep. You have to stay outside in the elements. It's minus 15, 20. They open the door and they're feeding you there, right? How does that make you feel as a person? The tent city was really their only choice. I've gone through it a few times and brought food down there. Right? And a lot of them was some people that I knew and worked with, right? So it was really challenging to see that.
It was pretty emotional throughout the pre-vaccine times, because we had no idea about how sick a person would get.
And then it's just like a switch was flipped. It showed up at the doorstep, of the nation.
We didn't realize and understand that once it hit the First Nations community, it was going to be rampant because you look at typically the First Nations communities, overcrowding, lack of affordable housing, multiple families living in one unit.
Our healthcare system, in BC was fragile before COVID, and I think COVID, pushed it to the brink and beyond.
We had to, cancel surgeries, postpone surgeries, anything elective had to be canceled, a lot of procedures, so that had an impact on a lot of our patients as well.
And there were times where we were working for a period of 10, 12, 14, 16 hours a day.
Delivering food, delivering care packages, figuring out the care packages, trying to get them to manage through the symptoms, checking on them every day.
FNHA staff members over there would call them up. It's like, hey, we got a grocery list. Can you deliver? They would go and drive all the way out to middle of nowhere sometimes, like in snowstorms. Like, it was crazy.
I remember coming out of the hospital in the ambulance. I said, what am I doing in the ambulance? I asked the lady, and she said, we're taking you to Terrace. You're sick. I'm not sick. Yeah, you're sick. So they put me in a room by myself in Terrace. The last dream that I had was I went to my wife and I said, I'm really tired. I can't do it anymore. That's when they turned me around and I woke up. That's when the hell started. It wasn't bad when you were incubated, but after you got out of that stuff, that's when hell started, because you can't talk, you can't get up to walk. Then the next part is after you come home, and then you start seeing the people that lost their loved ones. Then I start feeling guilty. I feel guilty that I didn't die like they did. Why am I still here? I keep asking myself why. But there must be some reason why I'm still here.
On December, I think it was the 18th, that's when I got word from my parents that they were both infected with COVID, and that was a Friday. I remember that day clearly. They've been married well over 60 years. And my dad did not want my mom to leave, and so my mom left Monday, and Monday night, I got a call from the doctor. They, sorry to tell you, but your dad's passed away.
You know, as a people, we grieve together, and that's how we make it. And that's how we get through. You know, I have an experience with my cousin who passed away here in Prince George at University Hospital. And we never got to see him. We never got to say goodbye. We didn't get to tell him how much we loved him. And to this date, we haven't even had a funeral. You know, he was cremated.
This person passed away, their funeral's this day and this day, but it will be on Zoom. And to me, that's just so wrong, but it's not closure. It's not closure that the community needs, right?
So waiting till later means a lot of, to do that final goodbye is to do that final feast, to take care of things in a traditional sense and give people a chance to pay their respects to that individual. You know, those are unfinished in so many of our communities.
It was hard because nobody could be with them in the hospital, and they were shipped out of Fort St. James, and there were helicopters going back and forth like frequently. And that was even traumatizing, the sound of that helicopter going.
I couldn't even visit my aunt in the hospital forever. I got to see her twice before she passed, which is kind of neat. You know, I recorded, she was always keen on teaching people the language. So she wanted to sing the Haida Love song. She said, I'll teach them the Haida Love song. Anybody that wants to learn, I'll teach them the Haida Long song. You put them in contact with me. So do you want to do it right now? I'll record it. I'll record you. So she said, sure.
Okay, we have Ildagwai and the Haida Love song.
Now, กูกว่ากูดาวเขาดีเก็บเส้นยันสุดคงกีงเชียวหัวเลย
I think a silver lining of the pandemic, if you can have one, is that the pandemic's definitely given people an opportunity. It's given me an opportunity to get back out onto the land. Doing a lot of like medicine harvesting, there was some trapping going on, building sweat lodges, building cabins.
More people going back to traditional hunting and gathering, way more than in the past. And younger people and more families doing all of that kind of prep work and gathering and preserving foods.
Some communities, they encourage the people to go out onto the land. Like they actually had programs where they would give them $500 to go up and video themselves on their territory.
You know, we've been talking, kind of thinking about having this fishing derby for a while. And we thought, yeah, you know, this is something we could do. Family units could go out on their boat, go out as a family and food gather. It was very well received, that first little derby. But it was so successful the first year, we did it again because we were still in COVID for the second round. So the second round was called the second wave, the COVID catch, the second wave.
Our ways of life, our language, our art forms have all grown with this place. We've been here for longer than 14,000 years. We've reincarnated with this place for thousands of generations.
So I believe it was Christmas Eve, or maybe the day before Christmas Eve, I got a call from Chuck Welnick that they were coming.
That we had availability of a small number of vaccines, and it was roughly 10,000. And part of the issue then was how to roll out these vaccines in a timely way.
And it was like not even like 18-hour days. Like not even like and weekends, working to try to figure out how we were going to move forward in terms of getting this to as many people as possible that need it.
So at that point, it was decided that we would use our 10 nursing stations, where we do have nursing staff on board 7 days a week, 24 hours a day, and that this would be our best way to roll out those first waves of immunizations.
We took every mode, we used every logistical transportation option that we had.
It was moving so fast and things were coming at us. I liken it to building a plane while we're flying. So we're about to, take off, but hey, we're missing this still. We better get this wing attached to it so that we can land properly. Our office here became a shipping center. Overnight, Brittany did so much work and the team in the shipping department to make sure that everything was packaged up.
So we picked up the vaccines from our health unit. We did all the cold chain packaging. We jumped in the car.
I remember the cooler sitting beside me as I was driving. I think I even had it buckled in a seat belts. and we had to monitor it every hour for the temperatures. So I would stop and I would pull over and I would monitor it and write it down.
And then carried on through the snowstorm to Fort Nelson. Slept for the night, jumped in a helicopter the next morning in -30 weather.
And it was such an honor to be able to bring it into community. And when we got there, they did like a ceremony over the vaccine, and there were the chief and the health director were there to meet the vaccine, and we brought it in a good way.
We came in and landed, and there were the people. And they're waiting, and so thankful that we were able to get the product to them.
And it was pretty emotional to be flying in with this vaccine for the community. And this was the first dose. And to see, like, there's about 20 to 30 people standing around and cheering when the helicopter landed with this vaccine that was going to save the community.
Like that infrastructure, FNHA built out, we built out our infrastructure for the logistics and the transport of vaccines across the health authority very quickly, and an amazing group of people who just seamlessly make sure that that vaccine gets transported, and it's not easy to manage.
We understood that there's a long history of mistrust in the First Nations communities because of the historical and colonial impacts.
Well, when they rolled out the vaccinations, right, the first thing on every First Nations mind is, why First Nations first? Are they using us as guinea pigs to see if this works or not?
Primarily, it's just distrust, right, in something that's new. Like, this vaccine was developed really quick and fast, and like, people weren't sure about it, but they were willing to get their vaccine if it meant going back to a normal life and being able to see their family.
I remember when I was bringing the vaccine to the community, there was someone standing outside and they were really hesitant, and they were able to come in, and I provided them with some education, and we sat down together. I think it was around maybe a 20-minute conversation, so not that long at all. So after we had this conversation, they came to me to get the vaccine after. So it was just, the full circle.
We had, Indigenous people as greeters to welcome them coming in. We had our staff at the front that was doing all of the registering.
It was really beautiful. Just walking into the door, they had, cedar on the table and providing them the vaccines. They were so happy to even just grab the Yeti cooler that had the vaccines in it.
Then get Bannock on the way in, and we gave out goodie bags, and we had so much positive feedback from our clinics that people were calling their friends and asking if they could come down because it was so welcoming.
Welcome, every one of you, welcome here. The song I want to share with you all is the peace song. Ahoy, ahoy, ahoy.
All of our ancestors are around us, and that they are there to guide us. They have been alongside of us throughout this whole pandemic, and that they left us tools and mechanisms to survive through this pandemic, and we have. We have done it. We're almost there. We're not quite there yet, but we're getting very close. And by having this vaccine clinic, we're hoping that we can provide the vaccine to anyone who wants to be vaccinated.
I just got mine yesterday, my second dose yesterday. My arm feels like lead today, but I'm thankful that that's all it is, and so blessings to each and every one of you healthcare workers for all the work that you do. Oigs and Newsom, thank you very much.
Oh, super nice to meet you. Yeah. For sure.
Totally not ready. Hi, Robert. So my name's Jennifer. I'm the nurse that's going to be giving you the vaccine today. Stay with us for 15 minutes. Okay. So there's
arrows on the floor. We'll just ask you to follow the arrows to the waiting room on the other side.
Basically, just went in, asked a few questions to the lady about my vaccine, and see if it interfered with any of my meds, and it was all good.
My hope for the future, that COVID, as it ebbs off, is that we come out full force, our communities, and celebrating that this is over, and celebrating each other, and honoring, you know, those teachings.
I'm seeing that now as we're coming out and more people are seeing each other and being in bigger groups and just being excited to see each other.
The ability to come together and celebrate together. I think the hugs are the big piece, the ability to sit and laugh with one another.
Young people wanting to learn how to smoke fish or how to jar berries, or and I think that, yeah, the more we can focus on those gifts that were given to us through COVID and the lessons learned, then the stronger we'll be to just see this through to the end.
But it's so important to be able to see both views. It's just being mindful and being open-minded and not, you know, coming in thinking that this is going to be a certain way, or that, you know, everyone's going to use a medicine wheel.
I think the key to transformation is to have more First Nations people or individuals that grew up in First Nations communities make the decision to pursue a career in healthcare.
Very grateful for the Northern FNHA team. We've been through a lot together and quite the journey, and we've come out definitely stronger together and better together. And
what's really important is teamwork, really to reflect on that and to reflect on each of our ability to contribute. The other part of that is to be responsive to communities and to work with communities, to be accessible to communities.
The response to the pandemic wasn't just us as a health authority, and it wasn't just regional health authorities and Health Canada. There were boots on the ground that I think that we always need to remember.
But now, when I wake up, I look out the window, I see daylight. I thank the Creator for one more day at a time. It's not planning down the road anymore. It's if I wake up, I thank Him for another day to be on this earth.